Hello everyone, I'm Dr. Khatab from PACademia, and in this presentation we'll be talking about the varicocele. So we'll be talking about what is the definition of varicocele and the epidemiology, the causes, how to diagnose this condition, and what are the grading of the varicocele, how to treat it, and how to approach the treatment, and what are some complications that might arise from this condition. So to start with, the definition is what's a varicocele? It's an abnormal enlargement and tortuosity of the pamniform plexus, which is like a network of veins in the scrotum due to proximal obstruction of the spermatic vein. As you can see here, this is the pamniform plexus. It is enlarged and it's tortuous. This is the varicocele. And the most common cause of scrotal enlargement in men is the varicocele, and it's found on around 15% of healthy men. So now we'll talk about the etiology, like what is the cause of this. We can divide the causes into two subtypes, primary and secondary. The primary, which is the most common cause, which is unknown, like we don't fully understand why varicocele happens. However, and in this type, the left testicle is more commonly affected, around 85% of the cases. Why, like, what is the theory behind this? Is that, like, first, the longer course of the left spermatic vein, this one, as you can see here, this one, and it attaches here in the left renal vein at a 90-degree angle. The insertion of the left spermatic into the renal vein at a 90 degrees, and because also of its a long course, this predisposes it to slower drainage and increased hydrostatic pressure, which will lead to varicocele. And also another reason is that the left renal vein passes between the aorta and the superior mesenteric artery, which increases the susceptibility of the left renal vein for compression, which is called the nutcracker phenomenon. This will also lead to increased intravascular pressure in the left spermatic vein, which will lead to the formation of a varicocele. The other subtype, which is the secondary or symptomatic, it's caused by a mass in the retroperitoneal space, such as a lymphoma or renal cell carcinoma, obstructing venous drainage into the inferior vena cava, which causes a right-sided varicocele, or the left renal vein, which causes a left-sided varicocele, or a thrombotic event in which the pamniform plexus obstruction and renal cell carcinoma. And in this type, the varicocele persists in the supine position due to the physical obstruction of blood flow within the spermatic vein. Okay, so now we'll move to the clinical features, like how does a patient with varicocele present, or what symptoms does he have? First of all, which is the bag of worms. Here, shown in this picture, the scrotum will look like a bag of worms, and also the patient will have a dull aching pain on the side of the varicocele, like in the hemiscrotum, typically on the left side, as well as it will be like enlarged, and the patient might also feel heaviness of the affected scrotum, and like it will feel here like a bag of worms. It's like the classic term for this. And a person with varicocele, he will have worse symptoms when standing or performing the Valsalva maneuver. And a very important feature is that to differentiate the varicocele from the hydrocele or the hematocele is that the varicocele will have a negative transillumination. So like the light will not shine through. When you put the light in the scrotum, it will not shine through because there is no fluid. It's actually like dilated veins. Okay, let's move to the diagnosis. How to diagnose this condition. So, like clinically, you can observe it and like see the bagoform features. However, sometimes we order some imaging, such as ultrasound, and we see like if we can see if the vessels are dilated more than 2 millimeters. Like Doppler ultrasonography is like done to determine the grade of the varicocele, like if it's based on the extent of vein dilation and reflux when the patient does Valsalva maneuver. And in some cases, retroperitoneum imaging is also done. So here, as you can see on the left side, we have the ultrasound. So as you can see here, these are like dilated veins in the pampniform plexus, which are very highly suggestive of varicocele. And also here on the right side in image B, this is the Doppler sonography, which shows the venous reflux, which is also characteristic of the varicocele. And this table shows how do we grade the varicocele. So for grade 1, we will not have visible varicosities, and but there is reflux in vessels of the inguinal channel only when provoked, like by Valsalva maneuver. So this is like only diagnosed by doing the sonography, the Doppler sonography. Grade 2, we will have stasis and small varicosities of up to the superior pole of the testis, and we'll also have, but we'll also, like the reflux in the supratesticular region will also only be visible during the Valsalva maneuver. Grade 3, we have dilation of veins in the inferior pole of the testis in standing position, no enlargement in supine position, and the reflux is only like shown when provoked by Valsalva maneuver. However, in grade 4, we will have enlarged veins in the supine position. And in the upright position and Valsalva, the dilation intensifies. And sometimes in this grade, we have testicular hypotrophy. And the final grade, which is the worst grade, is grade 5. We have the venous enlargement in supine and prone position, and we have like evidence of testicular hypertrophy or atrophy. Okay, regarding the treatment, we have two approaches for this condition: the conservative approach and the invasive approach. So simply, the conservative approach is like for the the least severe or less severe conditions or less grade varicocele, we will only, in this condition, we'll only give scrotal support, as you can see here in this image. In this image. However, if the patient has testicular atrophy, like some of the testicular atrophy, severe pain, or infertility, in this condition, we will go to the invasive approach, which is the laparoscopic varicocelectomy. Okay, we will be ligate the pampniform plexus will be ligated, or percutaneous embolization. So finally, we'll be talking about the complications of varicocele. The most important and most feared complication is the testicular atrophy and infertility, which should be raised like a very level of high concern when you see an adolescent or a teenager with such condition. You should immediately like raise the alarm because in the varicocele, the the venous blood flow is like kind of stagnant, and it will cause the sperms that are produced in the testicle to like have a suboptimal environment. So like the sperm is produced at a 2 degrees Celsius below the average body temperature. When we have blood stasis, the temperature around the testicle will increase, which will cause like suboptimal uh, environment for spermatogenesis, which, if prolonged for periods, might cause testicular atrophy and infertility. Okay, thank you very much.